wabarakatuh. Hello guys, how are you today? Introduce myself before. My name is Ferdiana Sari Tidar and I am from 8th class. Today, we will discuss about word cancer, especially about breast cancer. Before we go to the topic, may I to explain what is the topic we will discuss today. Okay, for the first, we will discuss about what is the cancer, statistical data, cancer stage, cause of disease, cancer prevention, how to do a breast self-examination, sign and symptom, and cancer management. Okay, for the first, we will discuss about the definition of cancer, especially for breast cancer. Breast cancer is a malignant tumor or abnormal lump that grows in breast tissue and can start in the one of the both breast. Breast cancer can spread to other organs. For the next is statistical data. Based on Global 2020 data, the number of new cases breast cancer more than 2 million or about 11% of all cancer patients in the world. And then in 2020, more than 600 million people died from breast cancer. So breast cancer is the rank first of term of new cases of cancer and rank fourth of the leading cause of death in the world. For the next, do you know what the cause of disease of breast cancer? So, the cause of disease of breast cancer is divided to type. This is a non-modificable factor and modificable factor. For non-modificable factor such as female gender, older age, family history of cancer, genetic mutation, pregnancy and breastfeeding, menstrual period, and menopause, density of breast tissue. And then for modificable factors such as a hormonal replacement therapy, physical activity such as overweight or obesity, smoking and alcohol intake, insufficient vitamin supplement, and intake of processed food, and the last is exposure to chemical and drug. Okay, for the next is the stage of breast cancer. How many the stage of breast cancer? This is any 5 stage from stage 0 until stage 4. This is a stage 0 is defined to cancer has not spread to adjoining tissues, and the stage 1 this is defined for 2 stages. This is 1A and 1B. For 1A, tumor has grown to 2 cm or less and has not affected lymph nodes. And then for stage 1B, this is defined for cancerous growth in near the lymph nodes. For the stage 2, it's defined to 2 stages again. This is stage 2A and 2B. For 2A, this is defined to tumor growth is 2 cm and has affected the surrounding lymph nodes. And then for 2B, this is tumor growth between 2 and 5 cm. It may not have affected the lymph nodes. And for stage 3, this is defined to 3 types. This is 3A, B, and C. For 3A, is defined to tumor may grow beyond 5 cm and affect 1 until 3 lymph nodes. For 3B, this is divided to tumor growth extend up to the chest or skin and may have affected approximately 9 lymph nodes. And then for 3C, this is divided to cancerous growth affected more than 10 lymph nodes. For the last stage is stage 4. This is defined that the tumor growth can spread to distant lymph node and affect organs such as the liver, lung, and brain. Okay, for the next is about the cancer prevention. So we can be done with maintaining a lifestyle and then carrying out diagnostic tests, and then we can doing breast self-examination. So how to do a breast self-examination? For the step 1, you can stand in the front of the mirror and raise your hand above your head to look the change of breast like this in the front of the mirror. And the second step, stand in the front of the mirror with your shoulders straight and hands on your hip, and then look for change in the shape, size, swelling, texture, or intended or breast like this. Yes, like this. And the last step, you can lie down and feel your breast with right hand to feel the left breast and vice versa, or check for lump or thickening. Okay, for now, we move to the sign and symptom of breast cancer. Do you know what the sign and symptom of breast cancer such as fevered nipple, redness, dimpling, soreness, color or clear discharge, and lump or thickening. Okay, for the last, we can discuss about how the management of breast cancer. This is many steps to management of breast cancer, such as initial surgery, neoadjuvant or adjuvant chemotherapy, use and type of selective estrogen receptor, adjuvant endocrine therapy, surgical management with or without radiotherapy, avoid radiotherapy or alloport or PRP inhibitor, adjuvant radiation therapy, and with or without taxanes. So, how to care the palliative care to breast cancer patient? We can giving a palliative care to approach that improve the quality of life on palliative care patient and their families facing the problem associated with a life-threatening illness and problem related. One method that can be done for the end-stage cancer is such as SEFT therapy. SEFT is spiritual emotional freedom technique. This is through 3 steps. This is namely the setup, tune in, and the tapping. And then for the last, I have one tips to improve a quality of life of breast cancer patient. This is giving management diet nutrition after chemotherapy. Okay, from the discussion, I think for enough, and then I wanna give you all the conclusion and suggestion from discussion today about the breast cancer. So, the breast cancer is the most common cancer in the world. Development of breast cancer is caused by multifactorial. On the other hand, prevention of this cancer can be done by maintaining of lifestyle, carrying out diagnostic tests, doing breast self-examination. And then cancer management is done through pharmacological and non-pharmacological measures. There is a palliative care for the end of stage cancer, such as a spiritual therapy. And then before breast cancer occurs, it is better to do prevention with a diagnostic test or a breast self-examination and maintaining lifestyle. Okay guys, I think it's enough for discussion today. Maybe if you have any question, you can write the question on comment below, and then I have to answer it one by one. And then for the last time, I'm sorry if I make a mistake in the end of the word. Wassalamualaikum warahmatullahi wabarakatuh.